Welcome to Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management, a weekly conversation with area leaders about how to persevere during uncertain times. Now here's your host, Gary Shorman.
Hi everyone, I'm Gary Shorman and this is Forward Ever, Leading in Challenging Times. As you know, our show deals with leading in challenging times in Northwest Kansas, and around the country. And today I'm talking with Craig Poe, who is the CEO of High Plains Mental Health Center. And High Plains has been leading in challenging times in Northwest Kansas for over 60 years. Craig, welcome to our program.
Thanks for having me, Gary. It's great to be
You know
on.
what, when I talk about leading for 60 years, you guys have really been doing that down at High Plains. And I have to say congratulations for the work that you do down there. And in today's environment of whether it be here locally in the state of Kansas or across our country, the need for mental health is there. And High Plains is the one in Ellis County and Northwest Kansas to come to the rescue. So thank you to you and your team for what you do.
Absolutely. We serve 20 counties in Northwest Kansas, so it's a lot of miles, over 19,000 square miles that we cover. But it fits what we're here for over 61 years to provide that care for people.
Tell me about your team there. How many people are involved? Because that's a huge area. But
Yes.
before we talk about something new you're introducing, tell me about your team and how they take care of people in Northwest Kansas.
That's actually one of the things I noticed about this team. I've been here for not quite 2 years, and the passion and the heart that the individuals that work for us have is just incomparable anywhere else. We have a team of about 175 people that will be positioned to grow with some of the things we'll talk about later. But we serve individuals, over 7,000 individual lives that we serve every single year with that number of staffing. And we do anything from people that are seeing us for mental health challenges or even mental health crises, as well as people that are dealing with substance abuse issues and need some help with that. And we work in and around people in their communities and in their schools, just helping them interact with daily life and the lives that we're able to touch throughout that 19,000 square miles is something that is really hard to wrap your head around until you can sit and talk with the individuals that are taken care of.
You know, the last time we talked is you were just getting started. You were trying to get your arms around all the things that you do at High Plains. Did you come along any surprises along the way when you were trying to dig in and learn what all was going on?
I think one of the biggest surprises for me was coming from a more urban environment. And there's nothing wrong with urban areas, but out here we like to celebrate our rural nature out here. And knowing that individuals understood that we have to get up and work with the people across from us, the people across the street, everybody that we're coming in contact with, we're going to see again tomorrow. And that changes people's perspectives. And I'd kind of forgot that, spending so much time in the eastern end of the state, that people understand that we have to get up and work together the next day. And there's a little more compassion that goes with that.
You have to love that about our community. And when you see things that happen and the way our community does that and works one together, all in Northwest Kansas, maybe it's a rural thing, maybe it's the people that are here. You talked about, dealing and have, 7,000 individuals, but that also involves their families, extended families, and et cetera, that you're able to help. And coming in this spring, and want to transition to High Plains Mental Health. You announced a construction of a very important project in downtown Hays. It's the Crisis Intervention Center. Tell me about the Crisis Intervention Center, Craig.
Yeah, so not long after I got here, those of you that knew Walt Hill, he did a lot to advocate at the state level and the local level to try to develop something that we could serve people even more than we already are. And in his time here, they spent a lot of time at the state level and the association level discussing how those pieces could fit together. But it so happened that as I was coming on, the state was finalizing those regulations, and they published those the summer after I arrived for a crisis intervention center that allows us as a community mental health center and certified behavioral health clinic that we can serve people in a capacity that didn't exist in our license before. So we currently have our Schwaller Center that has 4 bedrooms, and it allows individuals to come on a voluntary basis and say, I'm having some mental health crises. I'm having thoughts of suicide. I feel like I'm a danger to myself or others, and I need some help. But they're voluntarily coming into that unit. This creates a level of involuntary care, not that dissimilar from what we do with the state hospital. So our licensed clinicians serve for those 20 counties as the gatekeepers for the state hospital. So if an individual is screened and they meet criteria to go on to state hospitalization, they would go on to Larned, where they rightly need to be to get the care that they deserve. However, there's wait lists at Larned, and the bed count is just not high enough. Oftentimes people end up on a wait list that could last anywhere from a day or two to 2 weeks before they actually get to the bed. And our facility would be able to serve them in between. So we don't replace the state hospital, but we're able to take them directly into our center if there is a wait list. And the unmeasurable number of people that we can get better help and faster access because they don't get the care they need if they're sitting waiting on that hospital bed at the state hospital. And so we're able to provide that right here locally in Hays, potentially diverting them from state hospitalization. Other centers that are open in the state are seeing about a 90% diversion rate, meaning 90% of the people that come in don't go on to the state hospital. And the life change that that can have for them is something we really can't measure, but we're really excited to be able to see it happen.
Well, Greg, for those that may not understand the significance of this, there are no outpatient detox facilities or crisis beds in Northwest Kansas. So people had to go to the state hospital or travel a long way. And in my case, if we can take care of our people, our families closer to home, that is better. And so being able to get this facility started in Hays, it's just going to be great. But that wasn't easy to do. And this is not easy to just go just because you have rooms. You can't open it up. Talk about the process to get this set up and what it involves.
Yeah. So we first said, sure, that's a great idea. Why wouldn't we want to have additional resources and places for people to stay, but it doesn't come at no cost. And so we did some exploration with the Docking Institute and determined that in order to make sure that we didn't run the risk of not having enough beds, we needed to have the number that we've chosen. We are currently landed at 16 beds to meet a Medicare requirement, but an additional 7 treatment rooms where we'll do sobering, which I didn't hit on too much before, but we also will offer acute sobering within this facility. Both are very necessary. But we had to go through and identify a location that would be large enough to have these number of rooms, as well as how we can afford this and get financial means to do so. KDADS has contributed a fair amount of money to it. We've also received very sizable donations from some local foundations. I'm excited about getting them out in public. But we still have a fundraising campaign going on right now. And it's something that we feel very hopeful that we will connect with the right people and understand what we're trying to accomplish to get that forward.
Greg, the number I saw, and correct me if I'm wrong, is that you're looking to treat 500 people and their families annually in this facility. Is that correct?
It's actually a little lower than we expect. We did initially think about 500 involuntary, but we're also serving people in that voluntary basis like we have in our Schwaller Center. And so we're looking probably closer to 800 individual lives a year that we would be serving to provide this facility.
And when you talk about that, those are people that don't have a facility now, and you look at that number coming in and what that means. And you mentioned the facility and what that takes. People have to be in that facility. That's what makes it work. You can have the rooms, but unless you have people to take care of the clients, what are you doing to find the right people to staff that?
So we have designed a plan that includes 24-hour nursing staff, as well as psychiatric care and therapists, case managers, and what we're calling behavioral health technicians. And we have to meet a minimum standard with the state of 4-to-1. So if there are 4 clients on the unit, there have to be at least 1 person assigned to them. Now, we wouldn't just leave 1 person by themselves, but that 4-to-1 ratio means we have to ramp up our staffing to the tune of about 50 additional people to serve a 24-hour facility here in Hays. And in order to be successful with that, we have created a differential in wages that has increased what we pay for these positions. We're just getting started with some of the hiring because we won't be opening until the spring of next year. But that differential pay, I believe, is attracting staff. We've had a lot of very positive feedback from people that we've asked, and we will be employing an average wage of about $60,000 a year by the time we total them all up, which is going to be millions of dollars put into the Hays economy. Obviously, we're doing it mainly because we want to improve client outcomes, and we found a financial way to sustainably do that. But the economic impact on Hays is also going to be very huge.
Well, that part of it, the people aspect of this is finding trained professionals to do that. And that's really, it's a blessing to the community to be able to have this happen. But where's the center located? What are you doing to make and build this and make it happen?
So we shopped around of what the available buildings were several times and landed on the old Hadley building. The old Hadley Hospital, we are renovating about a 20,000 square foot floor or wing of the building. And we're putting in a new elevator. So if anybody's drove by on 8th Street, there's a new piece of that old building. We added an elevator because of the importance of how we can care for people. Before, all entrances into the Hadley Center would be a public entrance. And we're talking about people that are sometimes on the worst day of their life coming into this facility. And so we created a private entrance with an elevator on the back of the building that will go directly up to the 3rd floor where this is being housed.
And your timeline for getting things done, you mentioned opening next spring. Does that continue to be a hard timeline? And where are you in the process today when we're talking?
I'm hopeful it will be a hard timeline. We have had some delays when we initially started the project. As you can imagine, construction is a fluid date, but we were looking earlier, but we've resettled on the beginning of March and hoping that that'll be where we stand. The construction and materials and everything else just really got behind on us. So,
well, you're not the only one construction wise, because you look around town. Had a chance to do a flyover this morning, actually, and you look at our town and how many projects are underway, projects that are being completed in our community. And so there's a lot of, I should say, pressure on people to get things built. In this case, it's like, boy, I wish we could have built this 10 years ago. But we're here today, and you and your team are doing that building. How can those listening out there help?
So we do have established a new website. It will link back to our other websites, but we wanted an easy place for people to see where we're going and how things are functioning. And it's donatehighplains.com. And we felt like that was easy to articulate when we're on things like this, but also gives a direct place for people to see what we're doing, and it'll explain what a CIC is and have some additional video content for them to see there as well.
Donatehighplains.com.
Correct.
Hey, that is pretty good to do. Craig, hold on just a second. I want to take a break here. I want to come back and wrap up with some other contact things that people know of somebody that needs help. High Plains has been a rescuing place for many. And I want to talk about how they go about maybe connecting someone they know or themselves into the High Plains operation and process. Craig, thanks for joining us on this first half. We'll be back with more after this.
Since 1776, the United States of America continues to stand tall. It's been tested before, many times. Through grit and the ability to move forward, we create better tomorrows. We help our clients live their best lives to and through retirement. We make it easier. Thank you, Kansas. Worth Wealth Management, enhancing lives and strengthening families.
Welcome back to Forward Ever, Leading in Challenging Times, with our guest, Craig Bowe, who is the Chief Executive Officer of High Plains Mental Health. And Craig, we talked in the first half about the new project that you have. That's a big thing. It's going to start next spring. You can go to Donate High Plains and find out all about it, donatehighplains.com. But in the meantime, you continue to help thousands. You just mentioned the number 7,000 people in Northwest Kansas. How do people get into your system? Because someone may be listening and say, I know somebody that needs help. I know somebody that needs some assistance with the way they're going about their life. Where do they go? How do they get into your system?
There's a lot of ways they can come in, which is intentional, but we want to give people the ability to come in the way that they choose. We have offices located, of course, here in Hayes, but we also have other offices in Osborne, in Norton, in Phillipsburg, and Goodland and Colby. And all of those locations they can, of course, find on our website as well. But they are able to call the main line as well.
Hold on,
And it
Greg.
is,
Hold on, Greg.
yeah.
Stop just a second. Something happened with the internet here.
Oh, no.
Yeah. So we made the first half of the program. I'm going to restart at our break, and we'll do this again and see. I want to check something on my end. Mine is working fine. Okay. We hope it's maybe a momentary thing here. And we'll edit out this last. Even though we were going good there, we were
That's all
going
right.
really good there. We were on a roll. Okay, let's try this again. Coming down in 5, 4. Welcome back to Forward Ever, leading in challenging times with our guest Craig Poe, who is the Chief Executive Officer of High Plains Community Health. Craig, we talked in the first half about your program that is doing all these things for crisis intervention. But every day there are people in our community. And you mentioned earlier, 7,000 different people are served by High Plains Mental Health. How do people that, if they know somebody or if they're having a problem, they just don't feel like themselves, they need help on a day in, day out basis, how do they get into the High Plains mental health process?
Yeah, thanks for asking. And we have multiple ways to get into services, and we do that intentionally. We want people to be able to find a way to us in a way that fits for them. We can call the main office at 785-628-2871 or visit our website at hpmhc.com. But we also have physical offices, of course, here in Hayes at 207 East 7th Street. But we also have offices in Osborne, in Norton, in Phillipsburg, Goodland, and Colby. And every one of those locations have an ability to connect back to any of the services that we provide here, as well as in-person providers out at those locations. One of the advantages that has come about with the technology of the world is us being able to have access to very high-level clinicians on our staff. We have one of the highly regarded medical directors in the state with Dr. Romerine here in Hayes. But we also have access to psychiatrists, one that has done research for Johns Hopkins and one that was a former professor at Duke. And to have that kind of access to that type of psychological or psychiatric care is something that is just not possible without the advent of televideo to get that caliber of individuals out here to Western Kansas, as we all know. Those individuals can serve people throughout all of those offices. And we also have, of course, very high level therapists and case managers and everybody there along the way to take care of our clients. We look for people to connect with us in what works best for them, whether they call or stop by. But we also have connections with the 988 crisis line, the National Suicide Hotline. They call 988, they will have somebody on the phone or directly through chat. And we offer 24-hour mobile crisis services. So if they're in our 20 county region and they need somebody to come out directly to them and interact with them at that day, it doesn't matter where they live, we will send a team out to them. And they may bring them back if they meet criteria and need to get a higher level of care somewhere in our facilities, or they may just sit and talk with them and connect them to services right there in their home or wherever they want to meet out in public.
So you go from telemedicine, connecting some of the best docs to individuals, all the way to going out to somebody's home and sitting down with them and help maybe provide a path to better mental health.
Yes.
Wow. That's a lot. And in today's world, it's obviously we have that feeling here and around the country when we see and hear of things happening, how important it is to be able to jump on or stop by or come see or go to a website and just ask for help. And I know sometimes that's the hardest thing, is to just ask for help. Any ideas for somebody and saying, oh, they know somebody that needs help on how to approach that?
It's one of those things where if you have that person's ear, you can have more impact than any one of the clinicians I talked about, me or you, because that person trusts and respects you. And I think the biggest thing we need to begin to do within our society is stop and have the conversation. It doesn't mean you're an expert to know. It's just encouraging people to know that it's okay if you need a little help. Everyone needs a little help now and then, whatever that might look like. Sometimes it's just a friend to talk to, and sometimes it's professional help that we offer. But when people believe that they shouldn't ask for help, they will hide it and keep it from people for years. And I think we can do a lot better as a group to just make sure our friends know that if they're struggling and they need some help, they should reach out. And those phone numbers or that website is one of the best ways. But we also have access points that I almost forgot to say. We have over 30 clinics and hospitals that we have iPads or even visiting clinicians that will come in and provide services directly in the hospital. And we're in over 100 school buildings in Northwest Kansas where we provide services in person there as well.
Well, Craig, that's a great way to end the program, because everybody can use help at some point in time. Great point to be made. And you guys provide so many of those services. I'm excited to see what happens when the new crisis center opens up, and because that adds to what we're able to do in Northwest Kansas to help our neighbors, to help our friends be better. You and your team over there at High Plains Mental Health done a wonderful job. We talk about leading in challenging times. Certainly is a challenging time in mental health right now to get good mental health, and we're happy to have High Plains Mental Health here. And you and your team, thank you for all the work you do.
Thank you.
Craig Bowe is our guest. He's the CEO of High Plains Mental Health. New projects coming your way next spring. That's a crisis center that brings new services to Northwest Kansas, and all those services they offer to all of us each and every day. Thanks for joining us on Forward Ever, Leading in Challenging Times. The program is brought to you by Worth Wealth Management, where you can live with confidence. I'm Gary Shorman. Thanks for listening.
Thanks for joining us for Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management. Join us right here next week for another episode with host Gary Shorman. Until then, remember to move forward ever, backward never.